If you're navigating the complex and frankly emotional world of fertility care, you've probably hit a wall of dizzying medical jargon by now. So today we're going to gently unpack a topic that sounds incredibly complicated, but is actually a massive ally for you, PGT-SR. We're going to demystify this whole testing process together and show you exactly how it can support your journey to building a family.
Look, let's just acknowledge the reality right up front. The fertility journey, it can be exhausting. It takes a huge emotional toll, and when you're suddenly handed a brand new, highly clinical term like chromosomal structural rearrangements, it is entirely normal to feel a massive wave of anxiety. You might be sitting there overwhelmed by this alphabet soup of medical terms, wondering, what do all these tests actually mean for me and my future family?
Well, first and foremost, you are not alone, and we are here to walk through this together. Think of this explainer as your guide right by your side. We're going to break down that medical jargon, clear away the confusion, and turn what feels like a really scary diagnosis into a manageable, highly hopeful roadmap.
Section 1. Your fertility journey.
This right here is what we call the invisible hurdle. You see, when a couple experiences recurrent miscarriages or prior challenges with IVF, it can be incredibly baffling. Because according to fertility experts, the people who carry structural rearrangements are usually completely 100% healthy. You'd have absolutely no idea you had this condition until you hit these roadblocks in family planning. It's a huge shock because, hey, you feel fine, you are healthy, but there's this invisible genetic factor at play behind the scenes. Section 2. Understanding structural rearrangements.
Okay, let's dive into what this actually means. Imagine that your DNA is a massive, beautifully written encyclopedia that contains literally all the instructions for making you, you. Your chromosomes, they're simply the individual volumes or books of that encyclopedia. So, a chromosomal rearrangement just means that somewhere in that vast library, a paragraph or a page was simply moved to the wrong book. The information is all still there, it's perfectly intact, it's just bound in a different spot. Now, let's look at one specific type of rearrangement, called an inversion. Sticking with our encyclopedia analogy, an inversion is basically just a simple formatting mix-up. Imagine a paragraph in your book is printed upside down, or reversed. All the right words are right there on the page, they're just flipped out of order. Another type you might hear about is a translocation. Sometimes they're called reciprocal or Robertsonian, but please don't let those big words scare you. This simply means a piece of one chromosome, a page from one book, breaks off and gets attached to another chromosome or a different book. Again, the genetic material is all there, it's just sitting on the wrong page.
So here's the absolute crucial point. As a carrier of this rearrangement, you are perfectly healthy because you have all the necessary genetic information, even if it's organized just a little differently. The challenge only pops up when it's time to pass half of that encyclopedia down to an embryo. Because of the unique way your books are organized, it just creates a slight sorting issue. And that increases the risk of creating an embryo with an incorrect chromosome number or structure, meaning they might get a duplicate page or they might be missing a page entirely.
Section 3. How PGT-SR can help. Enter PGT-SR. This stands for Preimplantation Genetic Testing for Structural Rearrangements. If your DNA is the encyclopedia, think of PGT-SR as your expert, meticulous proofreader. This test's entire job is to read through the chapters before the book ever goes to print, making absolutely sure we select an embryo with a perfectly ordered set of volumes. And what this proofreader does is honestly brilliant. It detects any incorrect chromosome copy numbers. In other words, it looks for any partial or whole gains or losses of genetic material. It spots those unbalanced rearrangements to make absolutely sure the embryo has the exact right amount of chromosomal material before it is ever transferred to the uterus. It literally takes the guesswork completely out of the equation. Section 4. The step-by-step process. So what does this actually look like in the lab? It's a very clear, organized journey. First, the embryo is grown or cultured for about 5 days until it reaches what's called the blastocyst stage. At this point, it's made up of hundreds of cells. Second, the embryologist performs a tiny biopsy, safely removing just 5 to 7 cells. Third is the genetic analysis. That's where our proofreader goes to work. Fourth, the embryo is carefully frozen or cryopreserved while we wait for those results. And finally, step 5, based on those results, the most suitable embryo is thawed and gently transferred to the uterus in a subsequent cycle.
Now, a very common and completely understandable fear that expecting parents have is, wait, will this biopsy hurt my future baby? The answer is a resounding no. See, an embryo at this stage has two parts. The inner cell mass is what eventually becomes the fetus, and this part is left completely untouched and totally safe. The biopsy only takes those 5 to 7 cells from the trophectoderm, which is just the external layer. Your future baby is kept completely protected during the entire process.
By testing just those few outer cells, your clinical team gets all the information they need. This genetic analysis is the crucial key that allows the clinic to identify and select the embryo with an accurate chromosomal content. It ensures you're transferring an embryo that has the absolute greatest possible chance of thriving.
Section 5. Looking toward a hopeful future.
The benefits of PGT-SR are truly life-changing for carriers of structural rearrangements. By identifying the right embryo, this testing significantly decreases the emotional and physical distress of multiple unsuccessful IVF cycles. It drastically reduces the risk of miscarriage or a pregnancy with a genetically abnormal fetus. It lowers the risk of severe genetic conditions being passed down. Ultimately, it takes a cycle of stress and uncertainty and transforms it into a confident, illuminated path forward toward a healthy pregnancy. I really want to leave you with this final thought today. If you've been carrying the heavy weight of recurrent miscarriages or failed cycles, it is time to set some of that burden down. You are simply dealing with a structural rearrangement, a little formatting quirk in your beautiful genetic encyclopedia. But with PGT-SR, science is right by your side. Imagine stepping into your next cycle not with the fear of the unknown, but with the profound confidence of having a dedicated genetic proofreader working to help you build your healthy family. What could that peace of mind mean for you on your journey? Thank you so much for exploring this with me today, and I wish you nothing but the absolute best on your path forward.